Hi, welcome back. So excited to get to tell you about more research that we are presenting here at ACR, the American College of Rheumatology annual meeting. So my name is Ben Knoll. I'm the Director of Patient-Centered Research for Global Healthy Living Foundation, CreakyJoints, and the co-principal investigator for Arthritis Power, which hopefully many of you are familiar with or members of already. And I'm joined today by one of my favorite people in the world to work with, Dr. Megan Clowse.
Excellent, thank you.
Yeah, thank you.
So I'm Megan Clowse. I'm a rheumatologist, and my clinical and research interest is in reproductive health and pregnancy for women with rheumatic disease.
Great. So Megan and I worked together this past year. I guess it took us about a year from kind of start to finish, right?
Least.
At least, yeah.
Maybe two.
Oh my God, because we've been talking for a while. But it really came from our patient community. So as many of you know, Arthritis Power has a patient governor group. And in the first 2 or 3 years of the project, we had the same patient governors working with us. And two of the patient governors, Rochelle Crow-Hercher and Whitney White, both of whom are fantastic partners. We're very interested in this topic, and we'd heard from many other people that the area of reproductive health, reproductive concerns, especially for women with inflammatory arthritis, was a big deal. There are a lot of unanswered questions, a lot of confusion out there. There's science that's not kind of well disseminated about this area. So we wanted to do a survey of patients within our community and learn more about the attitudes, the perspectives, what kinds of choices people are making. So Rochelle and Whitney are co-authors on the abstracts that got submitted and accepted here. We presented 2 posters yesterday. So I'm going to not talk very much and let the expert actually let Dr. Clowse tell us a little bit more about the study, why we did it, what we learned.
Absolutely. So I was really excited when you called me about this study because I always like to hear what women with inflammatory arthritis really want to know. And what I've learned through this process is how wise a lot of our patients really are, and how they know so much more than they share sometimes with their doctor in the room. And so it was fascinating to really get both Rochelle and Whitney's views on what we should be studying, and then to get all the patient responses has been really so enlightening. So it was funny, when you came to us, we actually I worked with a couple of fellows, and with Taysir and Malithi, who were fellows with us in rheumatology, and they, the 3 of us, we came up with some ideas of things that we thought we should ask the patients about. And when we then talked with Rochelle and Whitney, they were like, "Why are we going to ask questions about that? That's not what we want to know about." But they came up with some really great topics that I hadn't thought of, but I think are really interesting and important to women, and I think answered questions that, to be honest, rheumatologists didn't even know was really on the minds of our patients. So that's really been a really neat experience.
So can you say a little bit more, give us some examples of what some of those questions that you wouldn't have come up with?
Absolutely. So I think the number one question was that it sounds like a lot of women with rheumatoid arthritis are concerned that taking birth control pills, oral birth control pills, might actually make their rheumatoid arthritis worse. So we heard from the patients that there are stories online about women who take birth control pills and then their rheumatoid arthritis really flares and they can't tolerate the pills. And we really got from them that this is actually a reason that some women aren't taking birth control pills.
Wow.
Which is important because, well, first off, it's important to plan your pregnancies when you have rheumatoid arthritis. We don't want to have you get pregnant when you're taking medications that can be really toxic to the baby. We don't want you to getting pregnant when your arthritis is really active, because that can be harmful. So planning a pregnancy is really important, and birth control pills is an important part of that for a lot of women. In addition, a lot of our patients take methotrexate, which we know causes birth defects, and in about twice the rate of the general population, so about 7% can have a birth defect, and it really increases the risk of pregnancy loss. Up to about 40% of pregnancies that are exposed to methotrexate can have a pregnancy loss. So it's really important to avoid getting pregnant when you're taking that. But if you're worried about taking birth control pills because you think it's going to make your RA worse, then it's just harder to get effective contraception. And I will tell you, as a physician who talks to a lot of women about contraception and a lot of doctors, I didn't realize that this was something that women were worried about. And I think it might explain why some of our patients, despite our best efforts, aren't taking the birth control pills. So I'm really excited that we actually got an answer to this one in the study.
Yeah, that's very cool. So what did we learn, I guess, in terms of, for example, are people varying the type of contraception they take based on the medications that they're taking? Because it sounds like from a doctor's point of view, that's important to have that discussion with your doctor, kind of review what you're taking for contraception or what you're thinking about family planning and what you're doing to manage your arthritis, because it's like you got a few things working at the same time, so you want to make sure it works together, right?
Absolutely. So one of the questions we asked was about what kind of birth control women are using now, and we only looked at that obviously in women who are actually trying not to get pregnant, or weren't trying to get pregnant, or weren't currently pregnant, or weren't already into menopause. So we wanted to look at women who are fertile and potentially could get pregnant. And what we found was actually about a third of women were not using an effective form of birth control.
Wow.
So when we consider what we consider effective, might not be what everybody thinks of as effective, but we consider highly effective things like an IUD, or an implant. They have a new thing called Nexplanon that you can actually, the doctor inserts into your arm and makes it really hard to get pregnant until you have it taken out. So those we consider highly effective because those two forms really make it hard to get pregnant. And we like those in particular because the woman on a daily basis doesn't have to do anything. It's there. Done. They can't get pregnant. We consider effective things like birth control pills, the Depo-Provera shot, which is a shot that you get every 3 months to make it so you can't get pregnant. Those things we consider effective. And then things we, to be honest, don't consider that effective are condoms, because with usual use, actually 10% of people using condoms every year will get pregnant.
Wow.
Which is a much higher rate, I think, than people realize. The withdrawal method, the rhythm method, both of those really have, if you're really trying not to get pregnant, are really not as effective as people would like. So a third of the women really were not using effective contraception. And then when we looked by what medicines people were taking now, there was really no difference based on what they were taking. So in this study, just like we found in other studies, women who are taking methotrexate seem to have also about a third of them don't use effective contraception.
Right. So it didn't matter the most the most toxic known kind of like methotrexate to medications that are apparently quite safe.
Right. Women not taking any medicines even.
Wow.
Yeah. The difference in the percentage of women not using effective contraception varied just a very small amount.
Okay.
Yeah, it was interesting.
So clearly that conversation may not be happening, or those decisions are not happening. It's not affecting people's
it doesn't seem like
now.
the message is quite getting through sufficiently. I wonder if part of that is that doctors might not be relating to patients quite the severity of what happens when people get pregnant on methotrexate. I think that the pregnancy loss issue is the most important. I mean, women really don't want to have a pregnancy loss if they can avoid it. It's really emotionally scarring. And so I think if women really understood that risk, they might make slightly different decisions, but who knows? It's hard to know exactly why it's not getting through.
And I think one of the other things we saw, wasn't it that a lot of people think that if they're on an arthritis medication or if they have arthritis, it's not possible to get pregnant. Is that right? Like it's something...
Yeah, so some people do think that one thing we hear pretty often actually is a patient will, and a doctor will have a misunderstanding, and when a doctor says you can't get pregnant on methotrexate, what the doctor means is you should not get pregnant on methotrexate. But I've had patients who, when a doctor told them that, they assumed that it meant that the methotrexate would prevent them from getting pregnant.
I see.
And so they've actually even stopped their birth control.
Wow.
Because they thought the methotrexate was taking care of it, which is not the message.
Right.
So it's just a small word change, right? But it can have a really big meaning. So when the doctor says you can't get pregnant on methotrexate, they mean you shouldn't get pregnant on methotrexate.
You must not get pregnant.
You must not get pregnant.
As opposed to it's not that you're not capable of getting pregnant.
Right. You need to do something to avoid getting pregnant.
I see.
On methotrexate.
So
yeah, it's an interesting small word thing that comes up.
There was another thing I remember. I believe this came from Rochelle and Whitney's involvement too. Was about the menstrual cycle. Right. There's some perception or some people's experiences is that it depending on where you are in a menstrual cycle, your arthritis symptoms may change, right?
Yeah, so this was, I thought, also really interesting, and as a rheumatologist, not something that I don't consider where somebody is in their menstrual cycle to how active their disease is. I don't think we're counting that in drug trials when we are assessing women over time to say where they are in their menstrual cycle and how that might impact their rheumatoid arthritis. But so we asked women in this survey, and half of them said that that their menstrual cycle impacts their rheumatoid arthritis. And almost all of them who said that it was the days right before their menstrual period or the first couple days of their menstrual cycle that they actually got worse, sizably worse in that period, and then they got better every month. So every month they had this up and down cycle, which I thought was really fascinating. Which leads, I'm going to lead into our kicker of what birth control pills do.
Yes.
So, because it might actually remedy some of the situation of the fluctuation. So our women said that 70% of the patients said that taking birth control pills had no impact on their rheumatoid arthritis. And about 10% said that they felt better when they took birth control pills, and about 10% said they felt worse when they took birth control pills. So there really didn't appear to be any kind of important trend about taking birth control pills and having rheumatoid arthritis change. So sort of this myth that taking birth control pills might make your RA worse, we didn't find any evidence for that whatsoever out of all these patients. What we did find, though, is that some women wrote in, the ones who said they got better, some women actually wrote in and said, I take continuous birth control pills. And when continuous birth control pills means that instead of taking them for 3 weeks and then stopping and having a period, and then taking them for 3 weeks and stopping and having a period, which is sort of the classic way to do birth control pills, instead you take either 3 months at a time and then have a period, or sometimes you can actually even, some doctors will have you just take birth control pills every single day and never have a period. That those women actually got away from this fluctuation. Really? So the patients who had really bad arthritis when were about to get their period, if they just took birth control pills all the time, then they didn't get worse. I thought that was fairly genius. And I think we're thinking about, for women who have fluctuating arthritis with their menstrual cycle, need to be on birth control, talk to your gynecologist about being on continuous birth control pills. It's something that the gynecologists consider very safe. You actually don't need to have periods. It actually doesn't help your health in any way. It's really, as a woman, just kind of annoying. So you can take them all the time and really escape some of this fluctuation of menstrual cycle.
That's so interesting.
Pretty cool, huh?
That is cool, yeah.
It is.
So we're so excited to work together to do more studies in this area, because a lot of this stuff is new, really interesting, could be useful, I think, for patient education, our work at CreakyJoints. One of the things I found, and I guess the question for you is, I always think of, what are the resources? What do people, and because many of our people in our community, of course, participated in this study, and so, thank you very much.
Yes,
This is amazing information, amazing data that people need to see, and we need to learn from it. But people often have the question like, okay, so where do I go for the best information? I know I can talk to my rheumatologist or my gynecologist, or like have, my rheumatologist tell my gynecologist in a note or whatever, or a phone call, what they talk to me about. But one of the things I found interesting in the results is that 60% of the 250 or so who took the survey are going to online sources of information, right, to help answer their questions.
Yeah, that was interesting.
And the number one, I think, online resource, something like 40% of people were going to WebMD, which is interesting, but the only 10% were going to what I think of as like the best resource in this area is Mother to Baby, right, the Mother to Baby website. So I guess, how do you feel about Mother to Baby? Do you recommend it as a resource? And are there other resources you would direct people to, maybe the patient guidelines, patient guides that you're part of too? Yeah, what do you recommend?
Yeah, there's a couple of really good resources online. So I really like Mother to Baby for two reasons. One is that they have really good information. So they are a group of pediatricians who study the effects of medications and causing birth defects. So they have really comprehensive write-ups about a lot of our medications. So if you find yourself pregnant all of a sudden and you're taking medications for rheumatoid arthritis, you can go to their website. You just Google Mother to Baby. That's, to be honest, how I get there. Google it. And they have, and then just put in the name of your medication, and they often will have a write-up about what the risks and benefits might be. sometimes it tells you there's just not a lot of information, and that's kind of how it works. But and what's really neat about them is that they actually have people on the phone all across the country. You can just call them at any time and talk to them about your situation. You know, I just found out I'm pregnant. I'm taking these medications that might be rheumatoid or arthritis medicines. Maybe they're your diabetes medicines. Maybe they're your depression medicines, whatever. And you can talk through all of that with a really knowledgeable person who can help you understand the risks and the benefits of your medications and what that really means about what you should do now to get you really good, up-to-date information, which is really an amazing resource that so many people don't use. So doctors can call, patients can call. So that's one great thing about them. The other really neat thing is that they're actually going to be a source of a lot of our information in terms of research going forward. So actually, since etanercept came out on the market, they've been collecting data about pregnancies in women with rheumatic disease in order to tell us what the risks of our medications are. So if you have inflammatory arthritis or any rheumatologic disease really, and are taking any medicines, you can call them and they actually might be interested in enrolling you in a study. And all they do, it's actually a really easy study. They just call you on the phone several times during your pregnancy and they talk to you about what medicines you've taken, all your other exposures, do you smoke, all this kind of stuff. And then they find out how the pregnancy goes. And they actually fly a pediatrician to you and to look at your baby to see if your baby has any birth defects whatsoever, major ones, minor ones, things that might have been missed in the hospital. So we get really detailed information. So all of their studies have patients who are taking whatever medication of interest. So basically almost all of the biologic medications have open studies with them right now. But they're also looking for women with rheumatoid arthritis who aren't on a lot of medications as their control group to compare. And then they also have healthy women who are involved. So it's a really great group to be involved with. And if you're pregnant and you're on medications, it's a great way to share your story and your data with women in the future.
That's so cool. Yeah, thank you. I knew I was familiar with them, but I didn't know all of that. That's amazing.
Do really great stuff.
It's like free counseling,
basically.
It is
free counseling. Absolutely.
Amazing. The other thing I like about them, it's not just the information they have for rheumatologic medications, but I noticed they have fact sheets for things that people might feel uncomfortable talking to their doctor about, like marijuana use or other drug. Like
they do. They have a lot of asthma stuff. They have a lot of they have a lot of great stuff. And those are forms that you should feel comfortable taking those to your doctor, right? So if you're on some medication and you've printed out the handout about that medication, feel free to take that to your rheumatologist at their next visit, because to be honest, your rheumatologist might not know everything that's on that sheet, and it might just help you guys get on the same page a little bit more easily. I think that rheumatologists trust mother to baby. Most of them hopefully know who mother to baby is, and so they won't think you've just come up with some crackpot thing off the internet.
Yeah, fantastic, right? Because the internet sometimes gets a bad rap, frankly, because there's a lot of misinformation on the internet. So I think that's why it's helpful to hear from the experts, what are reliable sources of information.
Yeah.
It sounds like that's a great resource.
It's a really great source.
And then we just published, I think this week, we just made available, right? Do you want to say a little bit about that? I know you were part of the...
Yeah, so I'm really excited to see this. This is it's basically patient guidelines for women with inflammatory arthritis who want to get pregnant. So cool. It's super comprehensive. Super comprehensive. Any question you have, there is an answer in that book and that website about it. It covers all medications that you might have ever been on. It includes a whole list of medicines that we consider compatible with pregnancy and with breastfeeding. It includes a list of medicines that we don't consider compatible. It has information about prenatal vitamins. It has information about which doctors you should go to, what to do when you find out you're pregnant, all that stuff. So it has really good information that I think can be really helpful to women. And again, you could take that to your doctor too and say, I found this. This is what it says I should be doing. What do you think? I think is a good way to sometimes start that conversation.
That's great. Yeah, and hearing from a doctor that's a good approach. That's good to know. So that's a resource available on the CreakyJoints website for download, basically for free. It's
Yeah.
like a booklet. We only have, I don't think we print that many, so that's
Right.
probably the easiest
I got
way.
one.
Yeah.
I'm excited. I'm going to take it home.
Special
share it.
people get one. But yeah, for most of us, just downloading it off the internet, the PDF is the best way to go. Before we wrap up, is there anything else you want to share about
Yes.
what we're learning here and what's next?
Yes, so my soapbox, this is my new soapbox. It's an issue that I think is really important and really overlooked, and that is breastfeeding.
Okay.
So really one of the take-home things from our survey was the tortured decisions that a lot of our women with rheumatoid arthritis make about whether they should breastfeed or whether they should treat their rheumatoid arthritis. And what is so heartbreaking to me about that is that you really don't have to choose between treating your rheumatoid arthritis and safely breastfeeding your baby. You can do both. And it was clear from our survey that the vast majority of women did not know that, and that their doctors weren't telling them that. And I think that that's something that we need to fix. I really feel like it's really tragic. So when we asked women about their breastfeeding, about 85% of them said that they either didn't breastfeed so they could take medicines, or they stopped breastfeeding to take medicines, or they didn't take medicines that they really needed in order to breastfeed. Like that, they really, avoided doing one of those two things in order to avoid risk. So only about 14% made made the decision to take meds that they needed and breastfeed. So, which is shocking. And we had a little box where people could write in what they wanted to say, and it was really heartbreaking. Some of the things they said, like, you read some of these. Remember, one of them was like, my doctor and I decided that it would be better to hold the baby than breastfeed the baby. It's just terrible.
It's a terrible choice, basically.
It is a terrible choice, and it's a choice that you don't have to make, right? Which is even worse. One woman wrote that her arthritis was so bad that her husband had to hold her baby to her breast for 6 months, and she was in bed the whole time because she didn't want to take medications that would harm her baby, she thought, and she felt like breastfeeding was so important. So, so my message really is that you don't have to choose. None of our medications have ever been shown to be harmful to a breastfeeding baby. There's some of them that haven't been measured in breast milk, so we don't usually recommend them, and those are medicines that often we don't use in pregnancy either, so methotrexate in particular. We don't usually use a lot in breastfeeding, though it's probably actually pretty safe. TNF inhibitors, we actually have data that shows minimal to no transfer of most of our TNF inhibitors into breast milk, and so I personally am very comfortable with women breastfeeding on TNF inhibitors. I've been doing it for a long time. Sulfasalazine we consider quite safe. Hydroxychloroquine we consider safe. Prednisone we consider safe. High-dose ibuprofen is considered safe. So, so you don't have to suffer without medications. You can take medications that you need to while you're breastfeeding, and still give your baby the milk that the baby wants. So, so that's my current soapbox.
That's
because
a
I
great
just
message.
think it's tragic
Yeah.
that women have to choose.
Yeah, because they don't have to, is what you're saying. Yeah. They just need to clarify with their doctor what is safe, and be confident too. I think that's right. That's the big message.
I think that's the big one, is that women are, they're nervous because, our whole cultural story, right? The whole thing that you've been raised with is that you shouldn't take medicines when you're pregnant, and you shouldn't take medicines when you're breastfeeding. And as a mother, you should sacrifice yourself for your child, and that is socially acceptable and actually expected of women, that you would sacrifice yourself for your child, and you don't have to do that. And a lot of doctors aren't comfortable with that yet. A lot of doctors, they were trained a long time ago, or a while ago, or by people who were trained a long time ago, and they just feel like it's safer just not to do it. It seems safer to not take medicines and to breastfeed, or just you don't need to breastfeed. It's not that important, and you can take your medicines. And they don't really try to, don't have the time to go and get more information. But there's really good information, really showing that it's quite safe to breastfeed on these medications.
That's great. Thank you so much for your
Absolutely.
time. So happy to work
My
with
pleasure.
you, and excited to work with you on more stuff.
Absolutely,
in the
you're
future.
one of my favorite people to work with
Well,
as well. It's great. This has been such a fun project. I've really learned a lot.
I agree. I totally,
Thanks.
I feel the same way. So thank you very much for watching. We're going to take another, I think, break, and we'll come back with more information from ACR. Thanks very much.
Thanks.